Good afternoon, everyone. Thank you for joining today's webinar. My name is Alberta Naaman, and I'm from the New England QIN-QIO, and I'll be your moderator for today's webinar, MIPS Practice Success, Lessons from Year 1, Maximizing Your Workflow for Successful MIPS Year 2 Reporting. Before we get started, I want to review a few housekeeping items. This call will be recorded for training purposes. I'll provide you with details on accessing the recording at the end of this webinar. The phone lines will be on mute for the duration of the presentation. We will take questions at the end of the presentation, and at that time, I will provide you with instructions on how you can ask a question over the phone. You can also pose a question in the chat box throughout the presentation. Please make sure to send the question to all participants. Today's presenters are Leah Brady from Internal and Pulmonary Medical Associates. Leah has 20 years of experience in the healthcare field and is currently their practice manager. Also, Abby Blake and Dee Porcina are from the New England QIN-QIO, and they will be facilitating this presentation. And at this time, just bear with me 1 second. Okay. Just bear with me 1 moment, please. So at this time, there is a disclaimer for this presentation. This information was prepared as a service to the public and is not intended to grant rights or impose obligations. This information may contain references or links to statutes, regulations, or other policy materials. The information provided is only intended to be a general summary. It is not intended to take the place of either the written law or regulations. We encourage readers to review the specific statutes, regulations, and other interpretive materials for a full and accurate statement of their contents. And we're having some technical assistance at the moment, so just bear with me, please. Hi, Jen. Is Jen on the line or someone from CMS?
Hi, Jennifer Webex.
Unmuted.
Hi, Jennifer Webex.
Hi, Jen. It's Alberta. I cannot advance slides. Let me try. I will try to send it to Dee and see if she can, but for some reason I cannot.
You do have the ball, so it should work.
Okay. I just transferred it to Dee.
And just make sure you click on the slides first and use page up and page down. And this is the ones that actually say page up and page down. There you go.
Okay. Dee can do it. Thank you. So, thank you all for your patience. At this time, I'm going to pass the presentation over to Abby Blake. And Abby.
Thank you, Al. So hello, everyone, and welcome again to today's presentation titled MIPS Small Practice Success, where we'll be highlighting a high-performing practice by the name of Pulmonary and Internal Medicine Associates. Myself and my colleague Dee Porcina will be taking you through this presentation by asking the office manager, Leah Brady, questions regarding her workflow and processes around successful reporting from the 2017 transition year. Here is a quick overview of the content we'll be covering today in the webinar. We will go through the practice demographics, a highlight of the EMR that Leah utilized for her reporting, the eases and barriers of reporting, the resources for practice use throughout the year, the performance feedback report, goals for 2018 reporting, the concerns Leah had while reporting, and then practice highlights. At the end, we'll have a few slides with additional resources from the QIN-QIO and time for questions at the end. This is a slide with the common acronyms you might be hearing throughout the presentation. I'm sure many of you already know most of these acronyms, but take a look at this slide if you need any further clarification. Some commonly used ones from this presentation might be MIPS, the Merit-Based Incentive Payment System, PQRS, Physician Quality Reporting System, and APM, Alternative Payment Model. Now we will jump right in and go over a little bit about the practice we are highlighting today, Pulmonary Internal Medicine Associates. This practice is located in Trumbull, Connecticut, and has 4 physicians and 3 mid-level providers. This practice is considered a small practice, meaning it has 15 or less clinicians. The doctors at this office are duly certified in pulmonary and internal medicine, and a few providers are also certified in sleep medicine. This practice is also PCME certified, which many of you know, being PCME certified counts towards your improvement activities category for MIPS reporting as well. This office has previous reporting experience in both PQRS and meaningful use, which are 2 legacy programs that have been rolled into MIPS. Leah and her practice were high performers in past years for these reporting programs and received a bonus every year for meaningful use. So just a reminder that this presentation is based off their 2017 reporting year data, so this is not real-time data. The practice reported for a whole year, and the reporting categories for 2017 were quality, advancing care information, now known as promoting interoperability, and improvement activities. Practices did not have to report on costs for the 2017 transition year, so those numbers were not incorporated into the final MIPS score. So the EMR that this practice utilized was the 2015 edition of Greenway Intergy. And again, they reported on a full year of data and submitted through their EMR system. This EMR has a user-friendly interface and has many built-in templates that you can utilize and customize to help make your work more efficient, which you will hear more about from Leah in just a moment. It also promotes interoperability by having over 1,000 healthcare networks that use its systems to connect with. Leah has been using Intergy for about 14 years and used it to report for PQRS, meaningful use, and now MIPS, and has been successful in reporting for all these programs, which shows the versatility of this EMR and how EMRs can be fully utilized. So Leah, can you describe your workflow at Pulmonary and Internal Medicine Associates for reporting for MIPS during the 2017 transition year?
Yes, I can. At first, I really didn't have a MIPS workflow, to be honest with you. So the first thing I had to do was identify the CQMs that pertain to our practice. To do that, I created a practice scorecard from our practice analytics program. And once I created the scorecard, I was able to identify the CQMs that we used here in the office. Some measures we excelled at and others not so much. So I took the measures that we didn't do so well on and really investigated what qualified the numerators and denominators. After I understood all the ins and outs of the measures, I created a plan to improve the numbers. I made sure that the plan did not interrupt our day-to-day operations or workflow. For example, CQM 125 breast cancer screening, our numbers were extremely low for this measure. I would say probably about 20%. This was not because we didn't send our patients for mammograms, but it's because we are primary and specialty. And all of our patients that we see for pulmonary were counting against us. So after realizing the problem, I educated our medical assistants and I asked them to ask every female that came into the office if they had a recent mammogram. If they answered the question, we recorded it, and if the patient was our primary patient and didn't have a mammogram, we ordered one, and if we would refer them back to their primary or OBGYN to get a script for the mammogram. Adding a simple question into our workflow brought our numbers up to 50% so far. I also tried to include as many high-priority measures in our workflow, so this way our numbers would elevate and we would get bonus points. Next one.
Great, thank you so much, Leah. So Leah's dashboard is very user-friendly, as you just heard. Their MIPS template and the EMR is similar to the PQRS template that they use, and it is customizable, where you can add tabs in for specific measures that your practice is following and plans to report on. When you click things within the EMR, it automatically populates into the customized dashboard instead of having to put things into free text boxes and not having a standardized way to track your progress. Although the dashboard is one day behind, it is still an effective way to track progress, especially if you are looking at it about once a week during the reporting period. Leah still has to manually submit through a scorecard, as she mentioned, within Entergy. She clicks the MIPS button within her EMR, highlights her measures, does a practice submission scorecard, double-checks all data and measures, and then does a real scorecard that she then uploads. One of the techniques Leah utilized was using a trial and error method with the measures on the dashboard to see what gives her the best score and potential bonus points. You could then upload the scorecard without submitting to see how the measure and information might affect her scores. So Leah, can you show us the MIPS template that you used in Greenway Entergy?
Yes, I can. Next slide. So this is a screenshot of our template that our medical assistants use when they bring in a patient. The form is actually a combination of 3 different forms. I decided to customize and merge the templates together so that our MAs could easily click through one template and not have to open and close 3 different ones. Doing this really helped streamline the questions and making sure questions were not missed, and also cut down on a lot of time that it took to open and close different templates. Next question, next slide. All right. This is a sample of our quality dashboard in our practice analytics program. This is where I ran all the practice scorecards to identify the CQMs that pertain to our practice. The dashboard is very user-friendly. I just had to click the CQMs that I would like our progress on. I changed the date in the reporting period section and then click the practice scorecard button. I usually export the results into an Excel spreadsheet so that I can filter through the measures easily. I also use this program to create the scorecards that I uploaded to the MIPS reporting site when it was time to file. And what I did was I would pick a few measures. I think it was about 11 measures I uploaded into the MIPS reporting program. And I looked at the score, and if I wasn't happy with the score, I deleted it, and I tried it again with different CQMs. So once I hit a high number, like 100, then I knew that we were ready to submit.
Great. Thank you, Leah. So we know that your practice is also a participant in the Reducing Cardiovascular Disparities Initiative in coordination with the Million Hearts Initiative. So what cardiovascular measures did your practice choose to report on in alignment with this?
We chose to report on CQM 138, the tobacco use and screening, and CQM 22, blood pressure screening and follow-up. Next slide. Here is an example of our scorecard for a specific measure. The scorecard I showed you before was all the measures combined, but if I just pick one measure, this is the scorecard that comes up. And all the information that's associated with the measure, like the numerator, denominator, percent, and health file are all located on this screen. I can also drill down to find out all the information regarding the patients in the numerator and denominator by simply clicking the tabs at the top of the screen. If I'm not happy with the score of a measure and want to investigate it, I click the Detail tab, and this brings me to the list of patients that are associated with the measure, and then I can start investigating as to why they're not counting in the numerator and figure out a way to fix it to bring our numbers up higher. Next slide. Okay. Here's another screenshot of our practice analytics dashboard that I drilled down to a specific measure. This one is the high blood pressure. If you can notice the percentage for this measure is very low, and I am in the middle of investigating this measure because I feel the score is too low. I think our practice, we're not clicking a certain button, and I'm going to review this help file and to see what qualifies the numerator and the denominator. And once I figure out exactly what needs to be done for this measure for the percent to go up, I will then put a plan in place and educate our providers and our medical assistants and nurses. And hopefully going forward we can achieve a better score on this measure. Next slide.
Julia, what were the eases of reporting?
I have to say I thought that reporting was actually very easy. In fact, it was so easy that I thought I did something wrong. I must have called Lisa Benton at the New England QIN-QIO a million times asking if I was missing something. She assured me I wasn't. The QPP site is much more organized and user-friendly than the prior Meaningful Use site and the QQRS site. Our EHR actually also played a big part in the ease of reporting. The Greenwing Intergy system helped spell out everything for me, and if I had questions about any of the reporting, I just picked up the phone and called the Intergy support team. They're so helpful there, and they were able to guide me in the right direction. Next slide.
So, just what were the
Do you have a question, or you want me to go on?
Yes. So what were the barriers of reporting?
Let's see. Most of the barriers were small and relatively easy to fix. And if I came across a barrier, I just kept digging to find a solution. It can be a bit time-consuming at first, but once you figure out the issue of the problem, then once you fix it, the problem's solved, and you really don't have to go back and keep fixing it. Like with the patient access measure and the mammogram screening measure, I always look for the best and easiest solution so that I don't interrupt our patient care or our daily workflow. I do have to say that there is one big barrier that I can't seem to find a solution for, which is the Health Information Exchange ACI measure. On the next few slides, I'll explain a little bit more. Next slide.
Great. So just a quick recap. The Health Information Exchange slide, this is a screenshot of the actual measure right from the QPP.cms.gov site. And we just want to stress that this is a difficult measure for practices to meet in Connecticut, and it will continue to be because there currently is no health information exchange in Connecticut. So Leah, do you want to speak to this measure a little bit?
Sure. Like I said before, this is our biggest barrier. It's impossible to get other practices to send us a summary of care for a patient they're referring into our practice. Even though you don't have to use the same EHR system, you can send these things through direct messaging. But getting providers to do that, it's really honestly next to impossible. I have sent out many emails reaching out to different providers asking for summary of cares for patient, and I haven't received a response yet. So it's really a difficult measure to meet. Next slide.
So like you just mentioned, so have you reached out to practices on the other end regarding the HIE measure?
Yes, I've reached out to many other practices. I have spoken to everyone from front desk staff to providers. No one really understands what I'm talking about, and if I actually am lucky enough to find someone that does understand, they don't have electronic medical records or access to direct messaging. I have tried to be proactive and, like I said before, send emails out to referring providers. And in my emails, I explain that I'm sending this information to help meet the MIPS Health Information Exchange measure and to please respond with new patient summary of care. I know it sounds a little silly, but I figured any little thing would actually help. But still no response, and it's very discouraging. But I'm hoping soon, before the end of the year, that I'll find a provider that is also striving to hit this MIPS measure. Next slide.
So did you provide education to your MAs around your MIPS workflow?
Yes, I did. The medical assistants have been educated on every measure that we report. I found that if they understand why they are asking certain questions and clicking certain buttons, things will make more sense to them, and that they'll be more careful about how they chart. For example, when I realized that they were charting things in a free text box instead of the actual MIPS template, I explained to them that our computer didn't read and register the answers that were typed in the free text box, that the numbers only would change and improve if they clicked the corresponding button. Once I understood how things worked, the numbers actually started going up significantly. Next slide.
So are there any specific resources you have utilized for the QPP program / MIPS reporting?
Yes, 3 actually. First being the New England QIN-QIO. They have been a wonderful resource. Lisa Benton is my go-to. If she doesn't know the answer off the top of her head, she reaches out to CMS for me and gets the answer. Also, Community Medical Group. CMG is an independent physician association that we're part of. They have a lot of knowledgeable staff that helps point me in the right direction when needed. And of course, I can't forget Greenway, our EHR company. They have an entire clinical team dedicated to MIPS, and they help explain measures and how the templates work so that we can better understand how the numbers are being pulled behind the scenes and how what we're clicking affects everything in the practice analytics dashboard. Next slide.
So how did you work with your IPA in reporting, and did they report any data for you?
I have a community medical group representative that comes and visits me quarterly. She's also available via phone and email in between site visits. So that's how I work with them. But they did not report anything for us last year. This year, they will report our Medicare cost savings information. Next slide.
So how comfortable did you feel reviewing your feedback report and your scores?
Well, to be honest, when I printed the feedback report, I got a little bit overwhelmed because it was 24 pages long. But once I started looking at the pages, I became very comfortable reviewing the feedback. The reports were very straightforward, and they really explained all of the measures and the scores in detail. Everything was listed on the report. All the benchmarks, performance points, and bonus points. It was very easy to read and not complicated at all. Next slide.
So now we'll move on to the performance report, and this is Leah's final score on her performance report, and you can see here she scored 100 out of 100 points, so getting all the maximum points you could get in each category, and this led her to get a 2.02 positive payment adjustment in 2019. So this goes over the chosen performance measures that Leah chose for her practice, and here is just an overview of the performance category, the submission method, the practice used, and the measures this office reported on. And this screenshot does not include the bonus or optional measures they reported on to get the 100% MIPS score. However, again, this is just an overview of the basic measures they chose to report based off of their specialty. And many of these measures are things that offices are doing at everyday visits. So many practices that haven't reported because they think it's too hard or too time-consuming should know that they possibly would be reporting on things they already do in their practice, so they don't necessarily have to add on any additional steps to their everyday work. So Leah, how would you suggest choosing measures that might not already be in your daily workflow?
Honestly, I really tried to pick measures that we could easily add. Things that were simple, yes-no answers, measures that just had a simple date, like the mammogram or the colonoscopy measure. Things that weren't too complicated, that we can just quickly ask the patient and add that in. Next slide.
So do you have any concerns regarding MIPS reporting for your practice moving forward?
I actually do. The cross-category and the health information exchange. I really am hoping to find another provider striving to meet all the MIPS requirements and help us with that health information exchange measure. And then in this year, the cross-category is being introduced. And I'm a little concerned with that one. This year, we scored a 3 out of 10. I know it didn't count, but it still was 3, and it was low. And it's a little bit too low in my book, but it's very hard to change that. We're a primary and specialty office, and most of our patients are elderly. I would have to say probably about 60% of our patients are Medicare-aged. And since our specialty is pulmonology, we really see very sick patients, ones with many, many chronic conditions. So it's hard for us to keep them out of the hospital and keep the cost down. But we try hard. Hopefully it will be good enough at the end of the year. Well, I guess we'll see. Next slide.
So what is your pace and workflow processes for this 2018 reporting year?
This year we're going to continue on the same path, report a full year. Since we did so well last year, I don't really feel the need to change anything going forward. I will continue to run my practice scorecard every 5 to 6 weeks to make sure the numbers look good, and if not, figure out why certain numbers are low. And actually this year I won't need to report on the improvement activities category because this past November we were awarded patient-centered medical home, which will automatically fulfill the improvement activity category for the next 3 years. So that will save me a little bit of time, time that I probably will be digging deep to try to figure out how to improve some of these C2M measures so that we can report more this year. Next slide.
So now we just want to quickly go over and highlight some great things that Leah did for her practice to be successful that others can do as well. So continuously running reports, trial and error with measures that are practical for your office, contacting and connecting with your EMR vendor to understand how to read your dashboard, and lastly, if you see a measure is low throughout the year, find the root cause, whether it be the MA or the provider. It could be easy as one click.
Okay, so at this time, we won't take any questions and answers. If you would like to ask a question over the phone, please press #6. You can also pose your question in the chat box by sending your message to all participants. And once again, to unmute yourself, press #6.
Hi, I have a question. Can you hear me?
Yes.
Hi. I am submitting a list of CPTs to CMS in order to get feedback from them on which measures a certain neurosurgeon is qualified for. When I go into the QPP website and I put EHR and neurosurgery, there are only 2 measures that come up. I've gotten conflicting information on whether or not we need to only submit those 2 measures, or should we work to submit, the full 6 measures, quality measures, and if we need to submit those additional 4, how can I tell what those would be? Because I'm sending our CPTs to QualityNet, via QualityNet, via the QPP help desk, and they're referring us to the EHR vendor, but our EHR vendor really doesn't have any experts to help us, so we're kind of doing our own validation work as a hospital. So what would be the recommendations? I know that there was one form that you could pull down off the QPP site that listed like all of the measures and all the submission methods and all the specialties that they were qualified for. And there happened to be a tab on there that you could do a lookup on CPT level but I can't find anyone to kind of validate my findings. So I know it's a complicated question, but is there a simple way to find out what measures your physician qualifies for if you just have a list of CPTs?
Hi, what's your first name again?
Amy?
Hi, Amy. I'm Lisa Benson. So the practice is neurology?
Neurosurgery. Yep.
Neurosurgery, okay. Is this going to be your first year reporting?
No, second.
Okay. And are you on certified EHR or paper chart?
Certified EHR.
Okay. So last year when you reported, did you report just to avoid the penalty or did you report to earn a possible incentive?
Earn a possible incentive also.
Okay. So you do know that you can pull other quality measures that don't have to be based on your specialty?
Yes.
Okay.
Because they would get credit for essentially other departments' work, I guess, right?
Exactly. And you can, I mean, we have specialties that will, that will go into the primary care or internal medicine quality measures, and you can pull those if they're applicable to the workflow in your office. Now, for last year, did you get a score? Did you have your feedback score?
We do, but actually our director, who's not in our office anymore, kind of ran the program. I'm just now kind of getting up to speed on what the requirements are. So this will be my first year doing it, but we do have the report and we're reviewing it now. We have a lot of stuff too. But that's aside.
Can you provide, do you have my contact information? Did you see it in the slide?
I did not in the beginning, no.
Okay. Okay. It's on the screen, but what I can do is I can give you my contact information, but can I also have your email address?
Yes, I'll send that to you right now.
Okay. Can you put it right in the chat box?
I'll do it. Yep.
Thank you. And then what I can do is, where's your office located?
We're in Weymouth, Massachusetts.
Okay. Okay, what I can do is I can go ahead and we can talk offline, and then if you need somebody to come out to your office, I can have somebody from that area, because I'm in Connecticut, come out to your office.
That'd be great.
Okay, great.
Thanks so much.
You're welcome.
Okay, so once again, a reminder that to ask a question over the phone, please press *6 to unmute your line, or you can post a question in the chat box. In the meantime, while we're waiting to see if anybody else has any more questions, I want to thank you all for participating today and for a great discussion. I have a few last-minute announcements before we end today's call. A reminder that you are now on social media. We are now on social media. Please visit us on Facebook, LinkedIn, and YouTube. When you close out of this webinar, the evaluation will automatically pop up on your computer. If you could please fill that out, we would greatly appreciate it. If you don't have time to fill out the evaluation right now, or you're currently sharing a computer with someone else, you will receive an email tomorrow with a link to the evaluation as well as a link to the event page on our website. These slides are available on the event web page, and within the next few business days, the recording and transcript of this webinar will also be added. I've put that link in the chat box for you. So thank you for attending, and if you do have any questions, let me remind you to press #6 to unmute your line, or you can put that question in the chat box, and please address it to all participants. Okay, everyone, thank you for participating and have a good day. Bye now.